Hey, welcome to another video from Skinny Medic, and this is kind of like an after-action medical report, but no action was taken, so I don't think there's really an after-action report, but it's a really cool short footage that popped up on Instagram this week, and the sickness in my mind, I watched it over and over again. It's like, oh gosh, that hurts. But let's take a look at it, and I want to kind of give you a treatment plan for this, and hopefully it helps you guys out. Let's watch it one more time in slow motion. So the scenario is you guys are at a pool party, all of a sudden your buddy or an acquaintance or someone says, hey, watch this, and boom, this happens. So what are you guys going to do? You never know when you're going to be the first responder. This is your treatment plan guidelines. So obviously the first thing that has to happen is someone's got to call 911. Okay, you've got to get first responders coming. If you don't notify them, they don't know there's an emergency. So you got to call 911 and say, hey, my buddy just jumped off the roof, laying on the concrete, and he's unconscious. Before we get started in how I would treat and help this poor guy, I don't know what happened to him. I don't know the outcome. I don't know if he lived or if he died, if he's a paraplegic, if he has a spinal cord injury. I have no idea what's going on with this guy. So the first thing I would do is you got to protect his C-spine. I mean, this dude landed perfectly on his face. The odds of him having a head injury, spinal cord injury are high. So we need to take care of his C-spine, but we also need to roll him over onto his back to check his airway and breathing. So we don't see any major bleeding here, so let's worry about his airway and breathing. So we need to roll him over and check his airway. So to do that, we need to keep his neck in an inline neutral position. So he's laying face down, so we need to roll him over to his back. So you've got some friends there, we can see in the footage. So get someone to help you. If you'll cross your arms over, and then get someone to hold his shoulders here, someone to hold his hips. We roll him over, you can keep him in line neutral position. So on my count, 1, 2, 3, and roll him over. So now that you've log rolled him onto his back, there's a real possibility he's going to have blood in his airway, he's going to have teeth in his airway, and you've got to work on clearing that out. Now if you have some kind of suction device, perfect. But you got to clear it out. You know, it's probably going to take a little while for EMS to get there. If he's got an occluded airway, that's a life-threatening injury. So I would use a jaw thrust maneuver to open up his airway and clean out his airway. Maybe I have to log roll him on his side and let the blood, vomit kind of come out. Now that we have him rolled over, let's use some sort of suction device to suction his airway. Maybe he needs blood suctioned out. Maybe he needs teeth suctioned out. Maybe it's actually clear and we don't need to do anything, but let's take a look at it. I would be careful sticking my fingers down into his mouth to kind of sweep out stuff. It's a very possibility he may bite down, and you do not want your fingers inside there. So patients with head injuries can be one extreme to the next on the breathing. They can be unconscious, breathing really fast that we probably need to bag or slow down. We can also have a patient who's unconscious and barely breathing that you need to bag to speed up their breathing. So using a CPR face shield or using a bag valve mask would help him in this situation if his breathing were not adequate or not good enough. Typically that range is going to be 8 to 28. So less than 8 times a minute we want to assist them with ventilations, or greater than 28 times a minute we want to assist them with ventilations. Put your hand on his chest and watch for breathing. If he's breathing less than 8 times a minute or greater than 28 times a minute, we do need to assist his ventilations using a bag valve mask to squeeze and to get some chest rise. The other thing that first responders are actually going to be concerned about is neurogenic shock. Means he's going to be pale, diaphoretic, he's going to have a low blood pressure, he can even have a low heart rate. So he's going to be in shock, but it's not a volume problem, it's a neurological spinal cord injury problem. So he may very well be in shock here, but it has nothing to do with blood loss, it's the neurological side of the body. So I hope seeing this footage helps you. A couple of key points I would take away from this video is keeping his head in line neutral position, trying to maintain C-spine. Also, vomiting is a real possibility here with a head injury. So you're going to have to build a way to suction protect his airway. So I hope this video helps. You never know when you'll be the first responder. Remember the right gear and the right training.